Hello, my name is Brianna Nicolas, and today the intellectual developmental disability we will be talking about is called Fragile X syndrome. So some of you may have heard about this in other classes, but today we'll be talking about the signs and symptoms, epidemiology, etiology, the treatment approaches, and the presence or lack of presence within the media. So Fragile X syndrome can be classified as an X-linked genetic disorder that causes learning and cognitive impairment. So this disease affects more males than females and will develop by the age of 2. So individuals with this disease exhibit anxiety, ADHD, autistic behaviors, and sometimes seizures. So most males and 50% of females also have physical characteristics that developed in the early years and then will carry on throughout their life. So these include a large, narrow face, large ears, prominent jaw and forehead, flat feet, and flexible fingers. And additionally, during puberty, males will develop a condition called microorchidism, which is, in simple terms, means enlarged testicles. Fragile X syndrome is a disorder caused by a mutation in the DNA segments within the FMR1 gene. For individuals with Fragile X syndrome, this segment is repeated approximately 200 times. So this mutation would inhibit the production of a protein, which will cause an altered nervous system functions, and also result in the signs and symptoms of Fragile X syndrome. Individuals with a lower amount of segments have an FMR1 premutation. So this means that they would be intellectually normal, have mild versions of physical characteristics, would be carriers and at risk for premature ovarian failure and ataxia syndrome. Genetic testing is one of the many tests that can be used in diagnosing an individual with Fragile X syndrome. Additionally, there are many early intervention services that are available aimed to help children under 3 years old in developing important life skills. So I'll just be covering some common myths about Fragile X syndrome. So the first one is children can be tested in utero or right after they are born. Myth number 2 states that girls cannot have Fragile X syndrome and boys are always severely affected. Myth number 3 states that everyone with Fragile X syndrome has large ears and a narrow face. Myth number 4, because there's no cure for Fragile X syndrome, there is no reason to be diagnosed. And myth number 5, all children with Fragile X syndrome will have a family history of this disease. So our goal by the end of this presentation is that you can learn some valuable information about this rare disease and also debunk these 5 myths that I've just given you by the end of this. We will also be going over the answers at the end, but I'll turn things over to Julia and she'll be telling you more about the signs and symptoms.
Thanks, Brianna, for giving us an overview of Fragile X syndrome. Now let's take a look at how Fragile X presents and some of its signs and symptoms. Fragile X syndrome is found in both males and females. However, symptoms appear to be more prominent in males. In males with Fragile X syndrome, mild to severe intellectual disability as well as learning disabilities are common, while females with Fragile X syndrome often present with only mild degrees of intellectual disability, if any at all. In fact, females with Fragile X syndrome can often live their whole lives without ever knowing they have the disorder. So, how is Fragile X diagnosed? It is often diagnosed in early childhood when developmental milestones are notably delayed or missing. The developmental markers used to diagnose Fragile X syndrome are often motor skill related and analyze a child's ability to speak, walk, and sit. As a child with Fragile X syndrome develops, they often possess hyperactive tendencies, which include some of the following symptoms: impulsiveness, hand flapping, rocking, head banging, and fidgeting. Along with these behavioral tendencies, those with Fragile X syndrome can also have issues socializing. This can be due to their inability to make and hold eye contact, adequately think before speaking, and their inability to remain attentive in social situations. It has also been shown that males with Fragile X syndrome can display aggressive tendencies that result in random physical outbursts and tantrums. Due to the presence of these behavioral and social tendencies, 30% of males are diagnosed with autism spectrum disorder before a diagnosis of Fragile X syndrome is made. This is because many of the presenting symptoms of Fragile X syndrome are closely related to those of autism spectrum disorder. Now let's take a look at some physiological and neurological symptoms that can appear in those with Fragile X syndrome. Those with Fragile X can possess hyperactivity-related neurological disorders. Studies have shown the presence of epilepsy in 10 to 20% of boys and 5 to 10% of females with Fragile X. The seizures generally present as partial seizures, but have also been characterized as tonic-clonic seizures as well as simple partial seizures. Typically, these epileptic episodes only occur between the ages of 2 and 10, though some continue to have seizures into adulthood. Both males and females with Fragile X syndrome often have comorbidities such as attention deficit hyperactivity disorder, obsessive compulsive disorder, and generalized anxiety. Now let's take a look at some of the physical symptoms of Fragile X syndrome. The majority of males and about half of females diagnosed with Fragile X possess physical features that become increasingly apparent with age. Some of these physical features include large ears, a prominent jaw and forehead, a long and narrow face, closely spaced eyes, flat nasal bridge, facial hypotonia, which is associated with slackness of lower jaw, pes plantis or flat feet, and in males diagnosed with Fragile X syndrome, macroorchidism, which is an enlargement of testicles occurring after puberty. It has also been found that those with Fragile X syndrome can have associated connective tissue disorders. Presence of this disorder can lead to the development of digestive and cardiac health issues such as gastro-reflux, hypertension, and heart rhythm abnormalities. Connective tissue disorders can also impact the development and integrity of joint capsules, which can lead to hyperactive joints, as well as scoliosis, which is the curving of the spine.
Thanks, Julia. I'm going to take a minute to discuss the etiology and epidemiology of Fragile X syndrome with you all. Fragile X syndrome is an X-linked dominant genetic disorder in which CGG groups are repeated on the X chromosome in the FMR1 gene. The FMR1 gene is a neurotypical brain's code for a protein called FMRP. However, the repeating CGG sequence in the affected FMR1 gene reduces or eliminates the production of FMRP. This reduction can lead to a range of disability and developmental changes, which we discussed earlier in the video. FMR1 gene mutilations are grouped into 4 subclassifications by the amount of mutation within the affected gene that the person has. An individual's FMR1 gene containing 6 to 40 CGG repeats is considered common. Having 41 to 60 CGG repeats would be classified as intermediate. An FMR1 gene with 61 to 200 repeats would be considered pre-mutilation, and full mutilation is when there is over 200 to 230 CGG repeats. Having full mutilation of the FMR1 gene is currently the diagnostic criteria in diagnosing Fragile X syndrome. Continuing the number of repeats on the FMR1 gene through a specialized blood test not only helps with diagnosis of Fragile X syndrome, but identifying individuals who carry pre-mutilation FMR1 gene can prepare individuals, families, and care providers for increased likelihood of having a child or grandchild diagnosed with Fragile X syndrome. Epidemiology of Fragile X syndrome. Fragile X syndrome is the most common single-gene cause intellectual disability currently known. Looking at the frequency in the total population, systemic literature review found that 1.4 per 10,000 males and 0.9 per 10,000 females have Fragile X syndrome. They also found that 11.7 per 10,000 males and 34.4 per 10,000 females have pre-mutilation of FMR1 gene. People who have Fragile X syndrome are at increased risk for many mental health disorders, including ADHD, anxiety, and behavioral disorders. Behavioral problems including poor eye contact, hyperarousal, and impulsivity are one of the strongest predictors of poor health outcomes in both individuals with Fragile X syndrome and their carriers.
Unfortunately, as it stands today, there are no definite Health Canada approved treatments for Fragile X syndrome, and therefore there exists no pharmaceutical cure for this disorder. However, there are various pharmaceutical trials that are currently being reviewed. Generally, the treatments and therapies offered to those with Fragile X syndrome target their associated symptoms rather than their core symptoms. The associated symptoms are often managed with known pharmaceuticals, such as serotonin uptake inhibitors for anxiety, stimulants for ADHD, and antipsychotic drugs to manage aggressive behaviors. Along with pharmaceuticals, those with Fragile X syndrome often undergo extensive therapy in childhood to help manage their symptoms. These therapies include physical therapy to help strengthen motor control, speech therapy to improve language and pronunciation of words, occupational therapy to aid with alternative approaches to tasks, and behavioral therapy to establish proactive strategies to help the individual navigate various situations. These therapies allow for an overall improvement to the individual's activities of daily living and help to establish proactive tools for those with Fragile X syndrome. Now let's take a look at a couple pharmaceutical treatments that are still under trial. Metformin, a common treatment for non-insulin dependent diabetes mellitus, is showing promising results for those with Fragile X syndrome. This drug has been found to regulate the excessive protein production found in those with Fragile X syndrome and alter cognitive and behavioral functioning. A case study conducted on 2 males with Fragile X syndrome showed an increase in overall IQ, improvements in memory, numeracy, and quantitative reasoning after being prescribed 1,000 milligrams of metformin daily. Another case study of 9 children between the ages of 2 and 7 with Fragile X syndrome, they were prescribed 200 milligrams of metformin daily. The results of this study showed improved problem-solving skills, communication, and a decrease in aggressive behaviors and tantrums. CBD is another potential pharmaceutical intervention currently being reviewed. If you've been paying attention to the news or various health platforms, you will know that the use of CBD in the medical world is on the rise. This once highly taboo drug has very little to no side effects, and because humans are born with endocannabinoid receptors, studies show that stimuli that activate this part of your brain can benefit various biological processes. In a study using mouse models with Fragile X syndrome, a close connection between the endocannabinoid system and the biological actions of the FMRP were made. As we have stated before, in those with Fragile X syndrome, there's a deficiency of the FMRP protein. This deficiency impairs the pathways of endocannabinoid receptors, which are associated with social and cognitive functioning. The intervention of CBD has been shown to improve the physiological impairments caused by the deficiency of the FMRP protein and treat some of the biological abnormalities of Fragile X syndrome. So though CBD does not cure the deficiency of the FMRP protein, it helps to manage and compensate for the lack of this protein. In addition to the compensating benefits of CBD, it has also been shown to increase synaptic functioning and plasticity of neurons. This is significant because an increase to synaptic functioning and plasticity can benefit cognitive functioning, which is imperative to one's ability to learn.
Thanks, Julia, for reviewing the treatment for Fragile X syndrome. I'm now going to talk about the presence of this disorder in the media. Fragile X syndrome isn't commonly talked about in the media. As such, little information can be found in the media on the topic. However, the media can still have a dramatic influence on the perspective of its spectators. Oftentimes, disabilities are portrayed incorrectly in the media. This inaccurate portrayal creates a stigma for all disabilities. A qualitative study in the UK on mental illness reported nearly 25% of respondents said that they noticed hostile behavior from their neighborhood because of the negative media reports. Similarly, a study found that 23% of individuals noticed an increase in depression and anxiety, as well as 25% of respondents felt deferred from applying for a job as a result. These beg to question the effect that the media has on the individuals and their community. Some mental disorders portrayed in the media can be misleading. For instance, in the show The Good Doctor, the media attempts to create a positive perspective on the main character, when in fact people with mental developmental disorders have a difficult time finding a job to begin with. These findings suggest that the media could be used as a tool to create a positive outlook on mental illness. Utilizing media to normalize mental illness would create a reduction on the stigma of mental health disorders. For more change to occur, the media needs to create better light for people with mental health disorders. The more the disorder is considered normal, the more the stigma is dissolved around the mental illness. All right, and I'm going to send you guys over to Andrew now to summarize all the findings.
Thanks, Sarah. We'll finish up this discussion of Fragile X syndrome with a quick summary of what we've been going over today. As we've seen, Fragile X is one of the most common genetic causes of intellectual disability in children. The signs and symptoms tend to be more pronounced in males than females, with the females having inherited a second X chromosome, which appears to dampen the effects of the extra CGG codons that are on the FMR1 gene of the person with Fragile X syndrome. The developmental and intellectual aspects of Fragile X syndrome are seen in the delay or lack of prominent motor milestones, notably difficulties learning to speak, sitting up, and walking. Additionally, it is not uncommon for people with Fragile X syndrome to exhibit hyperactive behaviors. They are also at an increased risk of having a dual diagnosis with either ADHD or autism spectrum disorder, to name two. Additionally, there are common physical characteristics of Fragile X syndrome. These include large ears, prominent chin and forehead, and a long, narrow face. We've also discussed how approximately 1.4 of every 10,000 males and 0.9 out of every 10,000 females will be diagnosed with Fragile X disorder. We've also discussed how that diagnosis is made through specific blood testing to take a look at the person's genome. Looking at the X chromosome, specifically the FMR1 gene, the scientists will then count how many repeats of the CGG codon appears on that FMR1 gene. If there's more than 200, the person is considered to have met the diagnostic criteria for Fragile X syndrome. We've also taken a look at treatments. While there is no specific cure for the genetic disorder themselves, there's plenty of treatments to help improve the quality of life for the person with Fragile X, and those range from primarily psychiatric drugs like stimulants or SSRIs, as well as behavioral and physical therapies to help with the day-to-day aspects of living with Fragile X syndrome. We also went through some interesting, more recent treatments, primarily the use of metformin and CBD. While these are still in research, they offer promise for further benefit to the quality of life of people with Fragile X syndrome going forwards. We also discussed how Fragile X syndrome, by and large, isn't represented in the media at all. We also discussed how the media tends to blend together disabilities and mental health disorders, and how the negative stereotypes typically portrayed of those characters can have a negative impact on people with Fragile X syndrome. We're going to wrap up by going through the answers to the 5 common myths Brianna told you about at the start of the video. Have you figured them out yet? Myth 1 suggested that testing for Fragile X syndrome is a common part of pre- or immediately postnatal care. As we discussed in the etiological section, there's a specific blood test for Fragile X syndrome, and at this point in time, it is not a common part of pre- or postnatal care. Myth 2 said that girls cannot get FXX and boys are always severely affected. As Julia told us in the characteristics section, females can certainly have Fragile X syndrome as well, and while males tend to have more severe symptoms than females, that doesn't mean that they're always the most severe. Myth 3 claimed that a child who has Fragile X syndrome will have large ears and a long, narrow face. And while, as Julia explained, those are typical of Fragile X syndrome, they are not always present. And in fact, those characteristics can change throughout childhood, particularly as the child enters puberty. Myth 4 claimed that there was no point in diagnosing Fragile X syndrome as there currently is no cure for it. Well, and as we discussed in the treatment section, while there is no cure, there are plenty of treatments and interventions we can use to help improve the quality of life for the person with Fragile X syndrome. Must have a family history of it. Well, as we described in the epidemiological section, there's a broad spectrum of FMR1 gene mutation leading up to the 200 plus repeats of the CGG codon needed to diagnose for Fragile X syndrome. So while a person diagnosed with Fragile X syndrome, they may not have had family history directly of it, but likely one or more of their parents are carriers, which is less than the 200 repeats that we discussed in the epidemiological section. Thank you again for your time and attention. We hope you learned something, and have a good one.